So students, today we are going to start a new topic, small intestine. So basically small intestine develops mainly from midgut. Okay, small, you can say that small gut starts from duodenum, involves jejunum, ileum up till the ileocecal wall. But since duodenum has got many special uh, relation with the surgical anatomy and the diseases, is what we take when we say small intestine. Usually we mean jejunum and ileum. Okay, till the ileocecal wall. The length of this small intestine, excluding duodenum, is about 300 to 850 centimeter, on an average about 5 meters long. Okay, the first 40% of it is jejunum and the rest is ileum. Jejunum basically starts at the duodenojejunal flexure. Ah, there's ligament of Treves there, just to the left of the second lumbar vertebra. Okay. Grossly, this jejunum is wider, thicker, and has got lots of valvulae conniventes. Okay. The mesentery of jejunum has got less fat, and the blood vessels are easily seen there. Okay. Whereas ileum is narrower compared to jejunum, is thinner, but the mesentery of the ileum is thicker and the blood vessels are not that easily seen there. Okay. Jejunum and ileum are fixed to the posterior abdominal wall by mesentery. Mesentery is attached just to the left of the second lumbar vertebra of the DJ flexor and goes obliquely on the right side towards right sacroiliac joint. Okay. This small intestine is supplied mainly by superior mesenteric artery, which comes from abdominal aorta, isn't it? Superior mesenteric artery is the main supply of small intestine. Okay. And the venous drainage is similarly the superior mesenteric vein, which joins the splenic vein and forms the portal vein. So all that venous drainage goes to the portal system and then to the liver. Okay, it's very important because most of the absorption occurs in small intestine and that goes by portal vein to the liver. There is also lymphatic drainage. Lymphatic vessels are there, and obviously all these artery, vein and lymphatics are present in between the two layers of the mesentery. Two layers of the mesentery of the bowel of the jejunum ileum. Okay, and they go to the superior mesenteric nodes and then to the para-aortic node. Okay, so this is roughly the anatomy of the jejunum and ileum. Jejunum, I said, microscopically it will be wider, thicker, and lot of valvulae conniventes will be there. Okay, whereas ileum will be thinner, narrower, it has got more Pierce patches. Lymphoid aggregates are there called Pierce patches. Okay. What about the function of a small intestine? Small intestine has got very important role in digestion and absorption of fat, carbohydrate, protein, okay, water, electrolyte and nutrients. Okay. These are very important for the absorption of these things. Especially jejunum, you see, all that protein which we eat, carbohydrate, they are digested by the pancreatic enzymes, and its products are absorbed in basically brush border of jejunum itself. And the fat is broken down by the pancreatic lipase, and the bile salts, it helps in the digestion into fatty acid and monoglycerides. They are also absorbed in the jejunum. So fat, carbohydrate, protein, okay, iron, folic acid, water, they are all absorbed mainly in the jejunum. Okay, a small part of it, whereas in the ileum basically absorption of vitamin B12 and bile salt sucker. Okay, suppose you have cut jejunum, jejunum has been transected, a part of it because of some pathology. Then what happens? That the function of jejunum is taken over by the ileum. Ileum can do all that which jejunum is doing. Okay, so it can adapt and it will absorb all the fat, carbohydrate, protein if jejunum is not present. But the only problem is when you reject ileum, the B12, vitamin B12 and bile salt are absorbed only in the terminal ileum. Okay, it is not absorbed in the jejunum. So if ileum is not there, if it is rejected, then person develops deficiency of B12 and bile salts. If the deficiency of B12 occurs, it ultimately leads to deficiency of vitamin A, D, E, K also. Their absorption also is impaired. So ileum absorption of B12 and bile salts occur only in the terminal ileum, whereas jejunum absorbs all the protein, fat, carbohydrate, iron, folic acid, mainly absorbed in the jejunum. Okay. So this is the function of the, and its jejunum surface area and ileal surface area is increased many-fold by this mucosal villi which is present, and so they have got tremendous role in the absorption of all the nutrients. Okay. Moreover, small intestine also produces some hormones like glucagon-like peptide GI1 and 2. Glucagon-like peptide GLP1 and 2 also produce motilin, which works with the small intestine enteric enteric nervous system to regulate the motility and of the small intestine and all that. So these are the basically the anatomy and physiology of small intestine. Next time we will discuss the diseases of a small intestine. Crohn's disease, I think I have already covered with ulcerative colitis. So next class I will discuss about intestinal tuberculosis.